Good afternoon, everyone, and welcome to our General Practice in Aged Care Incentive Lunch and Learn series. Today's webinar will be focused on the General Practice and Residential Aged Care Home Collaboration. My name is Carol, and I am the General Practice and Residential Aged Care Home Liaison Officer from the Aged Care team here at CESFIN. Today, I am joined by my colleague Kayla, who is our MyMedicare Support Officer from the Digital Health team. Before we begin, I would like to start by acknowledging the traditional custodians and sovereign people of the land across which we work. I recognize their continuing connection to land, water, and community, and pay respects to elders past, present, and emerging. I'd also like to extend that respect to any Aboriginal colleagues who may be joining us today. Just a few housekeeping tips before we get started. Please note that this webinar will be recorded and will be available on the CESFIN YouTube channel within the next couple of days. At the end of the webinar, an evaluation survey will pop up on your web browser. Please complete the survey as we do appreciate your feedback, and it will also allow us to issue your certificate of attendance. Please ensure that you submit any questions in the Q&A function throughout the presentation. To view this box, you can simply hover over the toolbar at the bottom of your screen. As part of our ongoing education series, we have several events coming up, including sessions on depression in primary care, respiratory failure at end of life, and cybersecurity for your practice. CPR workshops are also available monthly across the region, and you can find more information via the QR code on the screen. Just a friendly reminder that nominations are now open for our Primary Health Awards. These awards celebrate outstanding contributions to the primary healthcare teams in our region. We encourage you to nominate a colleague or team doing exceptional work. And again, you can scan the QR code for more information, but do keep in mind that nominations close on the 31st of August. CESFIN also offers a wide range of support services from accreditation and incentive programs to digital health and immunization. If you need help with anything from chronic disease management, workflows to secure messaging or pandemic planning, our practice support, digital health, immunization, and aged care teams are here to support you. Today's webinar is a series of 3, and today is the second webinar in which we will go through the collaboration of GPs and aged care home in the General Practice in Aged Care Incentive Program. Our last webinar of this series will be in 2 weeks' time and is presented by Kayla, who will run through how to track payments and visits for the incentive program. So now for today, our 3 main learning outcomes are improving your understanding of GPACI, including the eligibility criteria and service requirements, gaining insight into the role of residential aged care home staff in GPACI and how the program benefits aged care residents, and also learn how to use resources and toolkits to enhance coordination of care. So moving on, we will first go through a quick recap of MyMedicare and GPACI. So MyMedicare is a voluntary registration system that formalizes the relationship between patients, their GP, the general practice, and their primary care teams. The purpose of MyMedicare is to strengthen ties between a patient and their usual GP, to encourage continuity of care for patients, to allow GPs to better understand their patient populations, and to support a shift from episodic care to longitudinal, preventative, and multidisciplinary-based models of care. The General Practice in Aged Care Incentive, also known as GPACI, is part of the MyMedicare program and was developed on the 1st of July 2024. This was in response to the recommendations of the Royal Commission into Aged Care Quality and Safety and the Strengthening Medicare Task Force. The incentive is designed to meet the needs of our aged care residents. Aged care residents are usually older than 85 years old and often have complex physical and cognitive health conditions and experience reduced access to primary care and other health services. The purpose of this program is to enhance access to regular GP visits and care planning, strengthen relationships between residents and their primary care providers, and reduce avoidable hospitalization and improve continuity of care. In order to participate in this incentive program, both the GP and the resident will need to meet the eligibility criteria. For a GP to participate, there must be an eligible primary care provider, be linked to the eligible practice, and be declared as the responsible GP of services to the registered resident. This includes coordinating any services provided by the care team or the practice. For residents to participate, they must permanently live in a residential aged care home, and this does not include respite care. They must register with MyMedicare and be linked to an eligible practice and responsible GP. And they also need to have the general practice in aged care incentive indicator selected on their MyMedicare profile, which is completed by the practice. Moving on, so responsible GPs and practices are required to meet the servicing requirements to be eligible for the incentive payments. This includes the delivery of 2 eligible care planning items over a 12-month period. And these 2 care planning items can include a residential medicines management review, also known as a RMMR, a case conference, a care plan contribution, or a comprehensive medical assessment. In addition to this, they also need to provide 2 eligible regular visits per quarter, each in a separate calendar month, and delivering at least 8 regular services over the 12-month period. For the 2 visits per quarter, it's good to keep in mind that at least one of the regular visits must be provided by the responsible provider. A second visit can also be delivered by the same provider or another member of the patient's care team. This includes an alternative provider within the same practice, a GP registrar, a nurse practitioner, or an Aboriginal and Torres Strait Islander health practitioner or health worker. Under this incentive program, the responsible GP and their designated practice will be paid a quarterly amount. This payment will be paid in addition to existing MBS and DVA rebates for the services delivered. So why should we support GPACI? The incentive program aims to help people living in residential aged care homes receive better access to proactive, planned, and ongoing healthcare. We understand that residents have complex healthcare needs, a risk of avoidable hospital visits, equal rights to healthcare, and experience substandard healthcare. GP forms the backbone of healthcare for residents in aged care homes, and regular GP care results in better health outcomes. What we know is that access to GPs in aged care home has deteriorated, and there is currently an undersupply of GPs working in aged care homes, and this is projected to increase in the next 10 years. There are many benefits of participating in this program, and some of the potential benefits for residential aged care home providers such as yourselves include knowing that the residents are getting regular and coordinated primary health care, assurance that care plans are reviewed as needs change, having stronger relationships between the practice and the aged care home, giving the opportunity for residents to have a regular GP, feeling supported as part of your extended healthcare team, and meeting the aged care quality standards responsibilities by ensuring your residents can access safe and effective clinical care. There are also benefits for the residents, including having access to primary care services delivered in aged care homes, receiving regular care planning services, including health assessments and development of care plans, getting regular primary care services and responding to changing health needs, having formal established relationships between themselves as a patient, the GP, the practice, and other healthcare professionals, and also having increased continuity of care. Residential aged care home providers can support the implementation of GPACI by supporting the residents to be registered in MyMedicare and supporting practices and general practitioners to deliver services to residents in aged care homes. So firstly, we will go through assisting with MyMedicare registration. As mentioned earlier, one of the eligibility criteria a resident needs to meet in order to participate in the program is being registered to MyMedicare. A resident can register for MyMedicare in 3 different ways. So they can start the registration process in their Medicare online account or Express Plus Medicare mobile app. Alternatively, the GP can also start the process in MyMedicare and should trigger a registration in the resident's Medicare online account or through the app. Or thirdly, the most commonly done method in aged care homes by filling out a registration form and providing it to the regular GP. From here on, the practice will complete the registration process in the MyMedicare system. By signing the form, the resident gives consent to participate in MyMedicare, and residents will benefit from registering in MyMedicare to access more regular, proactive visits and care planning from GPs and practices. So on screen, I have an example of what the registration form looks like. This is just a snippet of the first page, but you can access the full 3-page form via the hyperlink on this slide once you get a copy after this webinar. To assist in the registration process, your role as an aged care provider would be to understand the incentive and provide clear information to residents, their families, and their carers. You can assist with consent and form completion. So this includes ensuring the resident understands and can give informed consent. If this is not the case, you may need to involve their substitute decision maker or enduring guardian. You may also need to provide residents or their families with the registration form. Actually, it's quite a good idea to integrate this form into your onboarding packs to make the process easier and obtain signatures and consent in the one go. You can also support them by filling in personal details such as their name, their Medicare card number, the GP practice details, if they have any difficulty writing or navigating online systems. You could also encourage families to be involved in the registration process, especially where residents may not be confident with the forms or digital tools. And lastly, you will need to coordinate with the GP or the general practice to assist residents in returning the completed forms to the GP and finalize the registration process. So now I'll go through how you can support both the GPs and the practices to deliver proactive care and consider utilizing existing templates to make the process more seamless for you and your teams. Aged care providers can maximize the benefits for residents by ensuring smooth access, timely communication, and collaborative care planning with GPs. And this can be done through facilitating access and coordination, supporting comprehensive assessments, enabling multidisciplinary collaboration, encouraging regular and planned care, documentation and communication, and also including resident and family engagement. We have created an orientation template for GPs to use in conjunction with their aged care homes. This template provides examples of key information you may consider sharing with your GPs as you onboard new GPs or would like to provide key contact information to your existing GPs coming to visit on site. It is also handy for the aged care homes to keep a master copy of this on site. Some of the key information on this form includes contact information during both business and after hours, your bed capacities, software systems and telehealth use, vaccine information, key contacts such as other current visiting GPs, your local health district geriatric flying squads, and your PHN contact information. Lastly, you're also able to upload a floor plan to make it easier for your GPs. Again, there is a hyperlink provided in this slide for you to access and edit this form. If your team or organization would like to add a separate letterhead or branding on this form, feel free to reach out and we can send you an editable version. I'll also quickly run through a few other templates you may wish to use or build on to support your GPs in delivering proactive care for your residents. On this slide, we have a table which summarizes the multidisciplinary team members and specialists which work within your aged care homes. These may include your RNs, your nurse practitioners, and other allied health providers such as physiotherapists, pharmacists, or social workers. This is a valuable resource to have readily available and make referrals easily accessible. Another template which may be useful to your team is a practical action plan for your home and the GPs. We have provided some examples for you to consider, such as the collaboration checklist on the left. This outlines partnership agreements, the orientation process, incident management reviews, annual immunization discussions, coordination of meetings, and care team introductions. Additionally, on the right, we have a collaboration action plan, and this can outline agreed meeting formats, scheduling of meetings, designated lead roles or representatives, and partnership visions. Here we have a quality improvement actions table. Again, this is just another guide for you to use or build upon, but the main idea is to help you identify and document agreed quality improvement actions that the aged care team and GP can undertake to support collaborative arrangements. There are opportunities for quality improvement areas, for example, administration, care access, medication charts, GP and residential aged care home communication. Continuing on, we have care planning activities, after-hours care, post-hospital follow-up, or advanced care planning. These are just a few activities to get you started and thinking about which quality improvement activities your team can be involved in. In accordance with ensuring quality and safety standards, this is a great way to continually monitor and drive ongoing quality improvement for accreditation purposes. To promote collaboration and shared understanding between the residential aged care homes and GPs, regular meetings should be set up to discuss collaborative activities such as quality improvement. Here on screen is a template for a meeting performer. Regular coordination meetings are encouraged and performers used to support discussion and note-taking. Again, you may already have an existing template you're using, and this could just be a template you can build on to assist with the collaboration of teams. We do understand that your role in the General Practice in Aged Care Incentive Program is important, and we're here to support you and your teams. A few of the ways which Assessment can support you is through supporting aged care residents, GPs, practices, and aged care home staff to understand the incentive. We will help to foster partnerships, facilitate collaboration, and improve in-care processes, provide you with up-to-date information and support. This can be done through promotion and discussion of the incentive, its benefits, and we do this through existing networks, forums, meetings, newsletters, and tailored education sessions. And lastly, we can also support by aligning with other government initiatives and reforms to support the care of aged care residents. I will leave you here with some more resources and readings in your own time. I do understand it's quite a lot of information to absorb, but if you have any questions, please reach out to our teams and we'd be more than happy to support you. On screen, I have put up our team's details should you wish to get in touch with us for further support. So we have here the practice support team, the digital health team, and the aged care team. Now, just before we open up the floor for questions, I do also want to let you know that Assessment publishes a monthly e-newsletter called Aged Care Connect. We provide up-to-date information on topics such as leadership in aged care, immunization, and digital health. We also share a lot of resources and training relevant to aged care providers within our region. If you aren't already and would like to be added to the subscription list, please email agedcareassessment.com.au. Thank you so much for your time and attention. I will now open up the floor for any questions and we'll be going through the Q&A box. So please pop your questions in the chat and then we can answer them live.
I have a question for you already, Carol. How does a person without the capacity to consent participate in MyMedicare and the associated incentive programs like GPACI?
Yeah, so if they are unable to consent, a responsible person can provide consent on their behalf and register to MyMedicare on their behalf. This could be a carer, a power of attorney, a guardianship order, or a next of kin.
And is that just for MyMedicare or is that also for the GPACI part of the program?
Yeah, so when they consent to MyMedicare, they are also consenting to the GPACI program, as the GPACI program falls under the MyMedicare program.
Great. What can a RACH do if they don't have a GP that's visiting them regularly?
If they don't have a GP visiting regularly, there can be recommendations made by the aged care home staff or even the family members. An easy way to do this might be to approach a GP that's already working on site. Since they're already visiting, if they're able to take on more residents or capacity, that might be an easy way to find a GP as well.
Great. So as a patient, if they register for MyMedicare, how can they know if they're also registered for GPACI?
Yeah, so the GPACI registration process, so long as they consent to participating in MyMedicare, it is the practice responsibility to register them to GPACI. So this is done through the portal in the backend, which Kayla will go into detail about in the next webinar. So it's good to get in touch with your practice and ask the GP or the admin staff if your resident has been registered to GPACI.
Great. We'll wait and see if any more questions come through.
Okay, some good questions so far. Thank you, guys.
Am I still eligible for the incentive if I have not seen my GP previously?
Yes, so to participate in the General Practice in Aged Care Incentive, residents will need to be registered in MyMedicare, but if they are residing in a residential aged care home, they are exempt from the MyMedicare requirement, which means that they had to visit their GP prior. But in GPACI, that's not necessary, so they can be registered with a GP they haven't seen before.
That's great. That definitely makes it easier.
Yes, it does.
Will patients be charged for the services they receive from their GP and practice under this incentive?
Regular MBS items, bulk billing, and out-of-pocket costs will still apply for the services. Apart from this, there is no additional charge for the residents to receive GPACI benefits.
Great. I have another question here. When does the yearly care planning start from?
So it starts in the quarter where the resident gets registered. So because the general practice and aged care incentive started on the 1st of July, if they got registered, let's say 18th of August, it would still start in that first quarter of the 1st of July. So that will mean July, August, September. For example, if they got registered on the 15th of December, that would be in the second quarter, which means their quota in the year will end on the 31st of December.
Mm-hmm. So yeah, definitely keeping track of where patients are registered in these quarters is something that I'll be able to go through in my presentation in 2 weeks. So if you'd like to see how we can keep track of that, then yeah, please join for that presentation too. I have another question here. If a patient registers with us, but they are registered elsewhere and they weren't aware of it, are there any recommendations on how to best deal with this if they are not computer or tech savvy?
Yeah, so the best way to deal with it is probably to get in touch with the practice, as they are in charge of registering the residents to both MyMedicare and GPACI. There are instances where they're not aware of it, and that would be dependent on the situation with the GPs, whether they've changed GPs in the meantime, or if a GP has retired and they were previously registered to that GP, but they haven't taken off the GPACI indicator in MyMedicare. So definitely the easiest approach is to contact the GP practices.
And yeah, I think if you coming in and taking over that patient's care and you register them with MyMedicare with you, even if they were registered with a different practice in the past, potentially when they were still living in the community, when you register them with you, they'll move over to your practice. So there isn't anything that needs to be done to, I guess, coordinate that. But yeah, it is tricky when patients aren't aware of if they've been registered with other practices or not. And then I think a follow on from that question,
Mhm.
so how, if the previous GP is retired, do we manage it? Have there been any changes to the period of time GP practices have to register patients manually? Um, I think feel free to reach out to myself. I'll put my email address in the chat with you and we can go through that together in terms of trying to manage this specific situation, in terms of GPs retiring, things like that. But there have not been any changes to the period of time that GP practices have to register patients manually. So I think that's referring to when the patient signs the consent form, then you have 30 days to then upload that onto Proda and register them in the system. So that has not changed. There's still that time period there. But I'll put my email address in the chat for you.
Do we have any other questions anyone would like to ask? We've got a bit of time today, so feel free to pop them in the chat box. Might give it another 30 seconds or so. Looks like we covered everything quite well, Kayla. No questions asked. Okay, can't see anything in the chat box, so might wrap it up for today and give you guys back some time. So thank you everyone for joining me online today to learn more about the collaboration between residential aged care homes and GPs in the incentive program. Don't forget, we do have a part 3 to this series in 2 weeks' time if you'd like to join. And a quick reminder to complete the online survey that will pop up in your web browser once this webinar is finished. We look forward to seeing you online next time and have a great rest of the day. Bye everyone.